Welcome to Mountain Stream TV. Today is September 9th, 2025. I'm Ron Arps. Today we're doing an interview as part of our Community Preservation Forum, and we're talking to leaders of nonprofit groups and government agencies that assist people in our area. They vary in their focus. Some of them are focused on health. We have nutrition, education, and housing. Today we have two people from Blue Ridge Health with us. Charley Thompson is a communications manager, and Donda Bennett is the regional practice manager for Jackson, Haywood, and Swain counties. Welcome to Mountain Stream
Thank
TV
you for having us.
and the Community Preservation Forum. We're very happy to have you here today, and I'm pretty much going to let you do most of the talking. I think the first thing we could do is have you introduce yourselves, and then we can do kind of an overview of Blue Ridge Health,
Sure.
and then get into some more specifics about the programs in Haywood, Jackson, and Swain counties.
Sure.
Sound all right?
That sounds great.
All right, I'll turn it over to you.
So I'm Charley Thompson, and
Oh, I was just pointing to the microphone.
oh, okay. Should I look at the camera? Should I look at you?
Well,
Okay.
whatever.
I'm Charley Thompson, and I work in Hendersonville as communications manager for Blue Ridge Health, and we serve 74 locations, and so we're pleased to be here today in Silva, near one of our locations, and with Donda Bennett, who is here with us too.
And yes, I'm Donda Bennett. I'm the regional practice manager, and I am in Haywood, Jackson, and Swain counties, and manage the medical side of those clinics.
Okay. So then tell us what the mission of Blue Ridge Health is, and your values and vision, and just some kind of general things like that.
I'm happy to. So Blue Ridge Health is a federally qualified health center. That means that we qualify for the federal 330 grant, which provides about 12 to 15% of our funding. We are one of about 1,400 FQHCs in the United States. There are about 14,000 lookalikes, but because we check so many boxes for the Section 330 grant, we get to be an official FQHC, and we work hard for that title. We are a community health center. We have about 74 locations in western North Carolina, spanning 9 counties, serving 50,000 plus patients. Our main tenets are affordability and accessibility. Accessibility meaning that hopefully if somebody needs medical care, they can find a Blue Ridge Health location somewhere near them, or we can get to them and help them receive that care, or that medicine, or whatever it is they might need. And I can tell you a little bit about how Blue Ridge Health was founded if you're
That would be
interested in.
wonderful.
So Blue Ridge Health was founded in 1963, actually, before there were even any federally qualified health centers. We were founded by a woman named Claire Burson, who was a nurse who retired to western North Carolina. And she retired from the Caribbean, moved here, and wanted to continue to volunteer and serve in her retirement. And so she went to a farm in Henderson County and started helping the migrant farm workers who were passing through. She realized there was such a need that she pulled in other provider friends, and Blue Ridge Health grew from there. We were actually named Blue Ridge Community Health Services in 1987 and have just grown exponentially from that time. So I like to say, if you ever doubt the power that one person can have to help a lot of people and make a real difference, Claire Burson is a wonderful example of that, in that we are now serving, tens of thousands of people. And she started out just as one person on a farm one day in 1963.
That's pretty amazing, and that's a good thing to remember. Sometimes I think about this little enterprise that we're doing and think, am I really doing something that's going to make a difference? But
Yes.
I'll assume that I am.
Yes, absolutely. So every effort makes a difference.
Yes.
And we like to call that, within Blue Ridge, we call it our Blue Ridge Heart. And I think that our employees are really special because we all really want to make a difference. We're driven by our mission, which is to improve health and inspire hope for the people of Western North Carolina. And that inspiring hope part is where the heart comes in.
Mm-hmm.
So, yeah, I agree. I think that so many of our clinics are founded on the backs of those who came before. So many clinics in our communities are founded based on free clinics that were already in existence, or those in the community that really want to help access to care and want to bring different services to the community.
Okay, well, so let's get into some specifics then, I guess, about the actual services that you provide. I looked at the website and there were quite a few. Medical, nutrition, behavioral health, migrant services, pharmacy, outreach. Do you want to just pick something from that list and tell us about the actual day-to-day operations?
Well, Donna can get into a lot of specifics about that, but I do want to note that we, again, want to have medical care accessible, which means really overall well-being for Western North Carolinians. It might be your physical health, it might be your mental health, you might be coping with addiction issues, or maybe it's dental health. Whatever it is, we want to be there for you, and if we don't provide that service, we're so connected in the community that we will help you find that service. And a lot of that is done through our outreach program, which is an extension of our medical care. We try to just get out into the community and find those people who need our help. So
Yeah, I agree.
maybe you want to talk about behavioral health or medical or?
Medical, yeah, I can talk about medical. So if you want to just start with the counties that I currently
Sure.
am in. Okay, all right. So we opened our Haywood Clinic in 2016, and we currently have six medical providers there in that clinic. And we have several service lines within that clinic. Alongside of primary care, we have a pharmacy downstairs where we're able to offer discounted medications to our patients. And those savings that we receive, we pass along to our patients. We have a medication assistance program where we get medications for our patients through the pharmaceutical companies, and we help them fill out those applications. Alongside of that, we do have behavioral health in the clinic. And right now we have 3 behavioral health providers that see patients. We offer group therapy as well, so we have a group therapy room there in that location. We also have a very strong outreach program that goes out into the community and helps people gain access. We work really good. One thing that makes, I think, Haywood stand out is that we work really good with the other nonprofits in our community. So when there is a need of a patient, we know where they can turn. We know who to turn to. So I think we do that really well there. Some of the service lines that we have within the primary care, we offer obviously adult medical services, but we also offer a medication assistance treatment program. We refer to it as a MAT program, and that deals with patients who are struggling with addiction issues. And we have also OB services for patients, as well as a pediatric service line. So our providers are able to do a lot of different things within the clinic. And there's probably some things that I'm leaving out about Haywood. I feel like what makes Haywood so strong is that there's a great support in the community for Haywood. It was built off of the Good Samaritan Clinic of Haywood County, and that was a a clinic that was in the community since 1996, and that clinic had about 5,000 active patients and transitioned into Blue Ridge Health in 2016. And so we knew that there was a great need. I'm the former executive director of the Good Samaritan Clinic of Haywood County. We knew that need was there, and one of the things that I always highlight about what makes this transition so amazing is the quality of care. So as an FQHC, we really spend a lot of time looking at the quality of patient care, and it's not just about access as much as it's about the type of care that we offer. And so we have these amazing patients that there are many times when they call into the office, we know them before they even tell us what their name is because we recognize their voice. You get that kind of hometown feel, which I love. And I think that speaks to the Blue Ridge heart specifically, is that for most of our employees, it's not just a job. For some, it's not just a career, but it's like a passion, and it really grows within you once you get started with Blue Ridge Health. So I love what we do, obviously. Our Jackson location is also a spinoff of the Good Samaritan Clinic of Jackson County, and that clinic is still located right down from Harris Regional, in the same location. And that clinic offers several different service lines. We currently have 3 medical providers and who offer adult and pediatric care, as well as we have a pediatrician. So Dr. Judith Sego, who has been in this community for many, many years. We're very proud that she's part of Blue Ridge Health as well. And so it's very exciting. On any given day, you may have a lot of kids running around the waiting room while you're waiting to be seen. And that's always a fun population to take care of. We also have behavioral health in that site as well. So that's a site that we are really spending a lot of time growing and looking at what the needs of the community are. Last month we brought the dental bus out. We had 2 days, and the dental bus served about 30 to 40 people within those 2 days, and that was really nice to have in our community. It's definitely a need there in the community, and we're very excited that Blue Ridge has the dental bus to bring out into the community. So you may want to speak a little bit, take turns a little bit. Speak a little bit about that.
We actually have 2 dental buses. They're
Right.
million-dollar buses that we got from a hospital system in our region, and they are dentist's office on a bus. So they come with just everything that you'd find in an office, but we're able to improve accessibility to dental services by driving these around. We might take them to clinics, as Donda was saying, or we might take them to schools, or to integrate our services. So we might take a dental bus to a place that deals only with addiction, and those patients can come out and have their teeth fixed after they've had counseling services. So integrating our services together so that patients have all their different needs met.
I think that's a great service, because it's so hard to go over here and over there,
It is.
especially if you don't have reliable transportation.
That's right.
Yes.
Yes. And so we do try to think about the whole patient. It's part of our mission, vision, and values that we think not only about the physical person, but what else can we do to make your life happier and improve your well-being.
Good. I also read that you have in-school services.
We do, school-based health services. So school-based health centers are doctor's offices within schools, and it's different from the school nurse you might think of from growing up, who might give you a Band-Aid and let you lie down in her office until your parents come. It's much more sophisticated than that. Not that school nurses aren't wonderful from the past. I don't mean to say that. Don't let me say the wrong thing. I value everyone. But these school-based health centers are full-fledged doctor's offices within schools. And so children don't have to leave school to go to the doctor, and parents don't have to leave work to take their children to the doctor. And so children are in school more, and the better attendance children have in school, the more likely they are to graduate, which of course leads to a better life. We're able to provide sports physicals and vaccinations for children through these doctors' offices. We are able to sometimes find things in children that might not have been found so early because we're in that school community with them, and teachers are referring them to us. So we're very proud of our school-based health centers. There are about 44 of them within the Blue Ridge Health community now.
Mm-hmm. Good.
Right here in Jackson County too.
Yes, we are in Jackson.
Yeah, I forgot which school it is.
We're in Fairview and
Fair-
Smoky Mountain.
Okay.
What's the geographical area that you cover?
We are in 9 counties, so we go out as far as Bryson City in Swain County, and then we go all the way east to Rutherfordton in Rutherford County. So, and we're continuing to grow. We have grown so much in the last 10 years, and I expect that we'll continue to grow into other counties, but right now, just 9 counties.
And I guess what do you think is pushing that growth? People don't have services available, or they
Well,
can't afford it, or?
It's very hard to keep doctors in rural counties in general
Hmm.
in the United States. And so part of our mission is to get more doctors into this region so that people have more accessibility to healthcare.
Mm-hmm.
And so we are hiring doctors. We have a teaching health center in Hendersonville where people come for their residency, and they'll spend 3 years working with what's through the Mountain Area Health Education Center, MAHEC. We partner with them to bring recent graduates from medical school into this region, and they work in Blue Ridge Health clinics and hopefully fall in love with the region, fall in love with the patients, and end up staying. And these past few years, our success rate has been very high. The graduating doctors have stayed in North Carolina, and a lot of them in Western North Carolina, and some of them even stayed with Blue Ridge Health specifically. So it's been a very successful effort.
Mm-hmm. So can we talk a little bit about who your clients are?
Mhm.
And is anybody eligible to come to a clinic, or are there requirements that you have to meet?
We welcome all people.
Great.
All income levels, all backgrounds. We really want to emphasize that anybody can come, whether you have insurance, whether you don't have insurance, whether you're underinsured, whether you're just looking for a wonderful quality doctor. We encourage you to come see us, and we have patient navigators who can help you find all the services you need and coordinate the services. Maybe you want to speak more to
Yeah.
the people we serve, who we serve.
Yeah, I mean, that's one of the things I love about Blue Ridge is just there's open access to care, and we offer a sliding fee scale to our patients. And so regardless of ability to pay, I mean, no one gets turned away when they come to the window. So I love that about it.
Mm-hmm.
We believe that healthcare is a human right, whether or not you have money in your pocket. So
For sure. Can you tell us a little bit about the sliding scale and how that works?
it's based on federal poverty guidelines. So let's say that I come in and I think that I might need financial assistance. I would fill out an application, and it's based on my family size and my household income. And then I would fall into a category, and basically within that category would be determined how much I might be able to pay for that visit. So maybe I pay $30. If I don't have $30 in my pocket, I'm not going to be turned away. But the federal poverty guidelines help us figure out who, what people might be able to pay.
Mm-hmm.
Good summary.
Thank you.
And it was very reasonable from what I saw on the internet compared to, say, my wife's last visit to the dentist.
Oh, yes.
So I certainly would encourage people to come and see you if they have, any questions.
Well, and even if people don't come as patients, move your prescriptions to us. Our, we're within the 340B program, and that means that we're able to offer discounted medication.
Mm.
So instead of, no offense to CVS and Walgreens and whatever, but if you move your prescriptions over, you're going to get probably a better price on them than you would
Mm-hmm.
somewhere else.
Well, I had no idea about that.
Mhm.
That's a great thing.
Mhm. And we deliver prescriptions. So if someone's unable to leave their house, then we will bring their prescriptions to them.
Mhm.
Just yesterday, I was interviewing a couple who are Blue Ridge Health patients, and they enjoy having a doctor who comes to their house for their doctor's appointments, and then they receive their prescriptions delivered from someone else. And they were just talking about the Blue Ridge Health community and really how it's just so personal to them because these people are coming inside their house. And their doctor was there with me while we were interviewing, and the doctor arrived at the house, and he was carrying his grandfather's doctor's bag. And just a jovial, kind person, Dr. Pace. And he took his shoes off at the door as a sign of respect and sat down and just visited with this couple who really just wanted to, they'd seen him in the paper, they wanted to talk to him about that. And it was really just, I felt the community so much. It was just a great example of the Blue Ridge Heart and how we really want to connect with each individual and honor each individual that we serve.
I had no idea that any doctor made house calls anymore.
I didn't either before I came to Blue Ridge Health. Isn't that amazing?
It is.
Yeah.
It is. You certainly serve the whole person, that's for sure.
Thank you.
The beauty of being a patient, I believe, is that if you have insurance and you're utilizing the services of Blue Ridge Health, you're helping fund someone who maybe doesn't have access in the form of insurance. And so I do believe that that's one of the things that makes our patients feel really good, is that there's that contribution of they're getting seen, they're getting excellent care, but they're also paying it forward. And I think that is like a full circle moment sometimes for me when I'm seen as a patient.
I love that.
It's really cool.
I love that.
So you said you take everybody, even people who are on Medicare?
Oh, yes.
Like me?
Oh, yes.
Certainly, absolutely. Medicaid, Medicare, private,
Mhm.
yeah.
All right.
Our full pay patients are, as Donda said, help to pay for those who aren't full pay. But we serve all people, all ranges.
Mm-hmm.
Mhm.
That's
Maybe-
one.
Maybe you want to take a moment to talk about the Blue Ridge Heart in regards to how we spun that off with the hurricane services that
Yes.
after the hurricane last year, because we're coming on the anniversary of the hurricane.
Of
Mhm.
Hurricane
Yeah,
Helene.
that sounds good.
Mhm.
Yes, we, well, just like everybody else, when Hurricane Helene came through, the Blue Ridge Health employees didn't have power. We didn't have cell phone connections. We didn't have water, and everybody wanted to know, what should we do? Our teams were calling us saying, or they weren't calling us. They were wondering how to get in touch with
Yeah,
us.
it was a few
Yeah.
days.
And so some of us who were able to get out went to some of the main clinics in our area, wherever we could get. And I'm getting chills just thinking about it. Our employees just started showing up. Whether or not they could get in touch with anybody, they just thought, well, I have this strong urge to serve, and I just need to get out and figure out what I can do. And so employees, whether they were from finance, whether they were from a medical clinic, whether they were from communications, or even on our chief officer, you know, even if it was a chief executive officer or operations officer, they were all there. And we just started trying to figure out, okay, what can we do? And there was a crowd of us gathered in the room, and somebody said, well, at my church, they're gathering water. And somebody else said, oh my gosh, my neighbor really needs water. And we just started putting all these pieces together. We had whiteboards, and we were able to serve so many people through this effort. And it was really just very organic the way we ended up gathering together. And so as the communications person, just witnessing this, we just kept talking about the Blue Ridge Heart. And so it's really just grown from there, I think. It was just such a obvious, palpable sense of compassion and care and urgency, really, for our employees to help other people and make a difference. And so, yeah, the Blue Ridge Heart's there, whether it's a hurricane or whether it's a regular beautiful day like this. You know, we try to show that.
One of the things I've been really impressed by in talking to the people in these interviews from different agencies and programs is how passionate everybody is. It's just, it makes my heart feel really good to know that there are people who have such a passion for their programs and for the people that they serve.
Absolutely. Our number one value is compassion. And I do the new employee orientation, and that's something that we really try to stress is, you know, everybody is carrying something. And when they walk in the door, whether they've driven 30 miles to see you or they live right across the street, you know, they're carrying something when they walk in the door. So just have an open heart and be ready to help. Yeah.
Do you ever have volunteers help in your clinics? Or
Not so much.
so much.
We are always looking for employees, though.
Hmm.
So if people want to come work, they can go to our website, brchs.com/careers, and apply for a job. We are growing so fast that we need employees, and we have, as I said before, 74 locations and a great need. And so it's hard to have volunteers in a place where you have to be certified in different medical skills.
yeah,
And so we don't do volunteers quite so much.
but like delivering prescriptions or?
Those are employees.
Okay.
Yep.
Do you hire nurses?
We do. Lots of nurses.
My daughter is a nurse.
Tell her to come on. Yeah.
And do you hire people who don't have medical backgrounds for?
Oh, sure, yes. I mean, I don't have a medical background. I'm in communications. And then we have finance. But, I mean, just like any business, there's all the different aspects of business that you could do. And then the outreach department, you know, we have a whole team of people who are going out into the farms, into the streets, really wherever the need is to serve, and then they would take doctors along with them. But trying to get to know the community and where the needs are.
Mm-hmm. Oh, many things to
Yes.
think about.
Yes.
I think one of the things that I think about when I think about our employees, I think you would ask, do you have to be have a degree or something like that? And one of the things that we do is when we hire a clinical support staff member who is really passionate about what we're doing, they have the opportunity to go ahead and get certified and become a certified medical assistant. And so we have partnerships with Blue Ridge Community College and help them get their certification. So we do on-job training. Our dental does as well. So it's putting back into people that are investing in us, and I like that.
That's such a good point. Yes, you don't have to have that medical certification when you come on board necessarily.
Right.
It can help you get that. That's a great point.
So we've covered a lot of things. Do you have anything else that you have in mind that you'd like to add at this point?
Well,
Wow, we have covered a lot.
we have a new CEO.
Mhm.
Our CEO was Dr. Richard Hudspeth, who's a family physician, and he was CMO before that, Chief Medical Officer, and before that was on faculty at the Teaching Health Center that I was describing earlier. So he's just resigned from, or retired, not really retired because he's so active, but from his position. And now we have Tammy Greenwell, who was our Chief Operating Officer for 16 years. And we're so excited to have her on board. And she was able to just come right in and engage with people immediately because she had that experience with Blue Ridge. So we're excited about that. It's big
Absolutely.
news for us.
Mm-hmm.
And we're 700 plus employees now. So,
Oh, my.
Wow.
Yeah.
Is there a child care aspect to your organization, like for employees?
Well, during Hurricane Helene, we certainly helped with that. But generally, no. I mean, a lot of pediatric services, though. We have on staff a pediatric endocrinologist, a pediatric pulmonologist, and a pediatric neurologist. Those are all doctors who, might have left the community had Blue Ridge not hired them. And so we're excited that people in Western North Carolina don't have to drive to Richmond or Atlanta or Charlotte to get those services. They have them right here in Western North Carolina because they work for Blue Ridge Health.
Mm-hmm.
And can you talk a little bit more about the funding of your organization?
Sure.
Where does the money come from?
Well, we're operating on about a $74 million a year budget. And as I said, only about 12-15% of that's federal funding. The rest of it comes from private donations, from full pay patients, from foundations. That's
That covers it.
that about covers it, I guess. Yeah. So a lot of buildings to operate. We lease some of our buildings. We own some of our buildings, and we continue to grow. And so yeah. If you want to make a donation, you can do that on our website as well.
And what is the website?
brchs.com. So that's Blue Ridge Community Health Services.
Okay.
And do you have any indication about how pending federal budget cuts will impact your operation?
Well, we are a very healthy organization right now. We're hoping that they won't, but I'd rather not speak to all of that, to be honest with you, because it just gets, yeah.
Yeah,
Healthcare is a hot issue right now.
it is. Oh, hot issues. That reminds me.
Oh, boy.
Do you have COVID vaccines available to people? The new formulation?
We do, yes.
You do? Oh, good. So I went to the pharmacy the other day, and I'm over 65, of course, and they said, well, we have them, but we can't vaccinate anybody because we're waiting for the government to decide who should get vaccinations. Which, I thought, well, I'm over 65. Everybody, they say 65 and older, you should get a vaccination. But
Yeah, and same situation. Sometimes these things are on hold. Even we have flu shots that are actually sitting in our office, and we're about ready to get started in the flu season as well,
Mhm.
and giving those
Oh,
shots out as
so
well.
you're not actually vaccinating people?
Not at this moment, yeah.
Okay, but it's imminent?
Yeah. Mhm.
And I'm really concerned because my wife is involved with working with children as a music teacher.
Mhm.
And I've always had a hard time convincing her that she should get vaccinated. And this year she wants to get vaccinated and she can't.
Oh, gosh. No, that's frustrating.
Yeah.
Yeah.
but.
But we can only do within the boundaries of what we can do.
Right,
so,
yeah.
Yeah.
And, you know, one of the things that Blue Ridge really worked very hard on is the COVID vaccine. So getting it out and pushing it out. There were many days that our clinics across the region were closed so that staff, and we actually did use volunteers to help with traffic, but we were in parking lots, we were in schools, parking lots, we were everywhere trying to get as many people vaccinated, and so we pushed that out to the communities, and I think we were on the forefront of doing that. back
Absolutely.
When COVID hit.
I felt like we were on the forefront with COVID, we were on the forefront with the hurricane, the wildfires. We're really trying to always keep our nose to the ground on what's happening right now within our community of Western North Carolina, where they really need us, and how can we serve? How can we help people understand what's going on? You know, for example, with COVID, nobody knew what that was, what was happening, what they should do, and we tried to learn as much as we could so we could educate the community, and we just want to be a resource, whatever that means. We want to be a resource to help people with their well-being.
How about some other contact information? Telephone number?
So if you go to brchs.com, it's pretty extensive. The information is all there, and the phone number, the different locations, and as I said, we
Right.
have so many. You can find all of that there.
Okay. All right, well, it's been great having you here today.
Thank you for having us.
Yeah, thank you.
I really enjoy your spirit and
Thank
and
you.
enthusiasm for your work. And
Thank you.
your sparkling eyes when you talk about what you're doing.
Thank you. We love Blue Ridge Health.
Absolutely.
Great.
We do. Thank you so much.
Thank you.